Yeah, just a quick review of the Iron Bull Strength 7mm knee sleeve. So this sleeve is made specifically for people that are having some type of knee problem or some kind of having like knee pain. And the idea here is that you put on the sleeve and it supports the joint and the surrounding soft tissues, restricts your knee motion, and that way your knee has a chance to rest, recover, and it doesn't get as overstressed as you're doing things. So a few points about this particular brace. As the name says, it does have 7mm thick neoprene, which is pretty darn good. Your average sleeve doesn't really have that much as far as I've looked around and seen. The other thing I like about this is a particularly long one. This is actually, the length is about 11.5 inches, which is good. So you're really getting a lot of support above and below your knee. So this is really good. Other things you can do besides put on a knee sleeve, as an example, I'm just getting it from Bulletproof Your Knee book. Strengthen your quadriceps muscles, okay? Your quads are a big muscle on the top of your leg. It's a main stabilizer, gives great stability to your knee. And what they're finding now is when you have a problem with your knee, you probably have decreased quadriceps strength. And some studies actually showing decreased cross-sectional area on like CT scans, meaning that it's smaller than it's supposed to be, just not as big. So, for instance, knee swelling in the quadriceps, this study demonstrated even if you have as little as 20 milliliters of fluid in your knee, which is just over a tablespoon, it's enough to decrease the strength of your quadriceps muscle. So if you have like chronic knee swelling, you probably have decreased quad strength. Knee injuries in the quad, if you ever had those, let's say, you've fractured your tibia, your lower leg bone, or any had surgery on your knee, they're finding when they look at they test people's quad strength, it's decreased, not as strong as it should be. Ligament problems, boy, anterior cruciate ligament, also known as your ACL, posterior cruciate ligament, if you've torn or ripped it, probably have decreased quad strength. Medial collateral ligament, knee pain in the quadriceps, chronic knee pain, that's enough to decrease your quad strength. Knee arthritis in the quadriceps, now that's interesting because they've done a lot of studies showing that when people have knee arthritis, they really have greatly decreased quad strength, okay? And likewise, they find in randomized controlled trials that if you strengthen the quadriceps muscle, okay, like just quad strengthening, a lot of the arthritic pain starts to go away. And they also studies have shown that the stronger your quads are, the less progression there is of your knee arthritis. So you can actually keep your knee arthritis from progressing if you keep your quads strong. Patellofemoral pain syndrome, the list just goes on and on. It's kind of crazy. Anyway, other things you can do, fine-tune control over your knee. Here they're talking about some of the hip muscles. Sometimes you have a knee problem, and it's not really due to any problem at your knee. It's because there's a problem up at the hip. So for instance, this one talks about your hip abductors. Now the classic case is like iliotibial band syndrome. So there's actually studies where they take groups of people with iliotibial band syndrome. They test their strength of their hip abductors, which is key in keeping your pelvis level and brings your leg out to the side. And they find that it's really decreased. And likewise, there's randomized controlled trials showing that if you take people with iliotibial band syndrome and you strengthen their hip abductors, they don't have the iliotibial band syndrome anymore. So isn't that crazy? Other thing you want to do, keep your knee flexible. We all know, knee flexibility, you stretch it out. We all know your knee bends and straightens. A lot of people don't know this, but about the last 15 degrees of you straightening your leg, your knee actually rotates. So it actually rotates laterally out to the side, like the last 10 or 15 degrees of you straightening your leg out. So that's an accessory motion that you can see if you have that with this test here, which is kind of cool. And there's some stretches you can get that back. Lastly, if you have increase your dynamic knee stability, here they're talking about your proprioception. So proprioception is your position sense. So like right now, if I turn the lights out, you'd be able to tell me whether your knee was bent or straight, okay? That's because there's little receptors in your joint and the soft tissues around your knee, giving your brain constant feedback as to where your knee is in space. And so what they're finding is when people have knee problems, proprioception isn't really up to par what it should be. And there's actually exercises you can do to get that back too. But anyway, nothing's quick as slapping on a knee sleeve. A lot of times it gets people instant knee relief. So yeah, this is a great sleeve. Check it out.